Plan G does everything an F does, as you can see, except one box is missing. And that is the Part B deductible. So if you remember, the Part B deductible this year is $198. So after paying that annual deductible of $198, all your medical and hospital costs are zero. Now again, monthly premium's a little bit higher for a Medicare supplement plan, but that's what I meant by predictable payment structures. Another popular plan is N, and there's a little bit more skin in the game here. With N, you can see hospitals covered at 100%, Medicare Part B medical is covered at 100%, but there's some asterisks. And when we asterisk down, which didn't fit in my graphic, but when we asterisk down, it'll say that there are some copays at doctor visits, $20 copays there. There's also a $50 emergency room visit if it doesn't result in an admission. So that's one of those extra costs. Another one is the Part B deductible, the $198. Also, excess charges. This scares a lot of people away from N, but excess charges is something where you say to the doctor, do you accept Medicare? He says yes, but he could charge a little bit in excess for his pocket. Very rare, very, very rare. In fact, in some states, it's actually illegal. But I think something like 5% do that. So the way around that is the technical name is Medicare assignment. If they're going by Medicare's pricing, they accept Medicare assignment. If you take Medicare assignment, yes, that's your doctor. If he implements excess charges, you can see him or move right down to the next guy. But those are three of the most popular plans that are out there right now. Okay, so Part D, the drug plan, this is also very, very important to note that we need to buy a drug plan when it's first available to us. Just like Part B, if we delay getting a drug plan, there can be penalties attached. I don't take any meds. Okay, well, I can get you the lowest cost drug plan, but it's important to note that we do need a drug plan. Let's say you don't get one 10 years down the road, you say, okay, now I want a drug plan. They're going to look at all those months of uncovered time and penalize you every month for life. Part B and Part D, that is the case. So that is definitely something that we want to get. And there's some inexpensive standalone drug plans, anywhere from, if you're not taking any meds, 13, 14 bucks. So when it's part of the Medicare supplement plan, option 1, I just mentioned prices range from 13 to 113. It's across the board. Not always is the cheapest plan the best plan though, because they take one medication, it could be on a tier 3 with one company, another company can put the same medication on a tier 1. I'll never understand the rhyme or reason there, but sometimes a more expensive plan can help cover somebody who's got a lot of meds. So we're not looking at just the cost of that plan, but an amortized overall price structure to make sure that we've got your meds covered at the lowest cost annually. Part of option 2, the Medicare Advantage plan, those are built into that. There's no additional fee for that. It's just your monthly premium for that Medicare Advantage plan, which again is medical, hospital, and a drug plan. You know what, I should mention real quick that on some of those standalone drug plans, most of them, there's a $435 annual deductible that applies to the higher tier meds, your brand or specialty drugs. Tiers 1 and 2 usually do not have a deductible on it, but the larger ones do. And if as your needs change, we can always change these plans. So it's good to review these every year as well. So part of option 2, going to that deductible, generally speaking, they're around $100 to $200 for those brand and specialty meds. Okay, so just to recap, option 1, Medicare supplement plan and a standalone drug plan. Option 2, Medicare Advantage plan, it's all plan. It's all kind of bundled together in a neat package. Let's talk about that real quick. So these are also offered by private companies, very low monthly premiums, sometimes zero for a monthly premium. And that includes your So the reason they could do this for zero, because there's co-pays and co-insurance. On the Medicare supplement plan, very little co-pays, in fact, sometimes zero with the plan G. So it's more of a pay in advance on the Medicare supplement side, whether you use the plan or not. This one is pay as you need it. So as you go see a specialist, you may have a copay of 30 to 50 bucks, and so on. So copays and co-insurance for medical services, prescription drug coverage is usually included, and most plans include extra benefits such as dental, vision, hearing, over-the-counter transportation, all sorts of pretty neat stuff. Let's talk about some of that. Some of the extra benefits, this is stuff that is above and beyond what Medicare offers. They throw in a fitness program. You can go to these network gyms as many times as you want. It's kind of neat. $0 on a lot of plans for a vision exam. They give you credit usually towards frames and lenses. Dental coverage, there's a couple of companies offering $1,000 worth of dental, comprehensive dental on their plans this year. It's amazing. Over-the-counter products, these are kind of neat too. This is stuff that you normally buy at Walgreens, you know, eye and ear, cold and cough, braces, bandages. You get little Johnny a toothbrush for Christmas. I'm sure you appreciate that. Transportation, discounted mail order pharmacy. That's kind of neat too, because you can walk into a preferred pharmacy on any one of these two options, but there's these direct mail order pharmacies. Well, they'll give you a discount on tier 1 and tier 2 meds and other ones, but the discount on tier 1 and tier 2 is amazing. Usually it's zero or very little, and you get a 90-day supply mailed to your door. Access to the 24-hour nurse hotline. You don't have to call your neighbor who was the school nurse anymore. Some virtual medical visits, and so on. So there's a couple kinds of Medicare Advantage plans. Again, going back to Medicare Supplement, it's any doctor who accepts Medicare. With these kinds of plans, they're networked. And as you know, we've got a St. Al's, we've got St. Luke's, we've got Salser. So there could be a plan that is a St. Al's only plan. There could be a St. Luke's plan. And then there's a couple that are broad network plans. But there's an HMO. HMOs, as you know, are very, very popular. The key to that is we have to stay in the plan's network. If we go outside of that network, we are on the hook for 100% of the cost. Very important to stay in network on an HMO. Another characteristic is that referrals are generally needed to see specialists. Not all the time with all the plans, but as a general overall rule, that is a characteristic of an HMO. A PPO, a preferred provider organization, you are financially incentivized to use the plan's network because there's two columns now. Instead of one column for an HMO that says you have to stay in network, we now have two columns. We've got this in-network pricing and out-of-network pricing. So in-network pricing, always going to be the best. But let's say the neighbor tells you about the best doctor since sliced bread. You want to go see that doctor, totally fine. You have out-of-network coverage, and they usually pay up to 80% or something like that. So you can see out-of-network doctors. And that goes across the nation, kind of neat. And just a real quick note, when it comes to emergent and urgent care across the nation, even though these are network plans, that is always covered at in-network pricing. Really important to know, so if you're visiting somebody for a week, 2 weeks, a month, whatever it is, you always have that emergency and urgent care covered at in-network pricing. And PPO characteristic, no referrals required. So, if now is the time to make your choice, there are some factors, right? And everybody's different. Everybody's got their specific individual needs, and it's good to take a deep dive into that at a later time so we can get real specific, but costs is one of those. How much will you pay for premiums, deductibles, co-insurance, co-pays? Benefits, are there extra benefits such as the vision, prescription drug coverage, dental, those kinds of things? Convenience, are the plans in-network providers conveniently located? If you're here in Meridian and your provider's out in Timbuktu, that's a plan that we might not want. Needs, and your needs for care, have they changed in the past years? Do you have anything upcoming? Is there a chronic condition? stuff that we need to know to make a very informed decision. And providers, we always want to make sure our doctors and hospitals that we prefer are in our network. Okay, let's hit a couple important dates. Let's say that you already have a plan. It's maybe you right now. You already have a Medicare Advantage plan or a Medicare supplement plan along with a drug plan. There are times to change those plans. You can change that drug plan or Advantage plan during the annual election period. That's October 15th through December 7th. When we make a change in that time frame, that plan will go into effect January 1 of 2021 this year. And that is a very important date to know. If we miss that window of opportunity, or you got pressure, you don't think you made the right change, or you want to make another change, you have a one-time opportunity after that, which is January 1st to March 31st, the open enrollment period. Now, that is specifically for Medicare Advantage plans, but that is there just in case you need it. That's a great one to know as well. And then there's some special enrollment periods, for example, moving out of your planned service area. Had some clients just move up to Garden Valley, Boise County, they moved out of their planned service area. You get a new a special enrollment period to choose a new plan. Also, we talked briefly about leaving an employer or group plan. Let's say that you keep that group insurance, you're 75 years old, you're going to retire now, you're coming off of your creditable coverage group plan, you now have a special election period into any of those plans. And a quick note when it comes to Medicare supplement, something I didn't cover that I wanted to mention. When we age into Medicare, or when we come off a group plan, regardless of how old you are, it's like you're turning 65. It's that initial enrollment period. That Medicare supplement plan is a guaranteed issue at that point. No health questions. So if you were to choose a Medicare supplement plan at a later time, then there would be health questions. It would just be underwritten, kind of like a life insurance policy. And if you have change with your finances, if you get extra help, qualify for Medicaid, there's a special election period there as well. Okay, that was a lot of information, really quick. Try to keep that to a minimum. You know we have somebody else coming up as well. If you have any questions, please call me up. You can always contact me through Silverbridge or my number here. And I really thank you for your time and attention, so appreciate it.
Thank you, Matt. Okay, we're going to switch over to our next speaker here. Oops.
So we're gonna do a tag team. What we're doing is, let's see where it's about. We're gonna do, I'll talk first. So what we're doing is I'm a financial planner, investment advisor. I know Robin and the group for, I don't know, 15, 20 years. It seems like more than that, but just a great group of people. And so what we're doing is I have an office in Eagle, and I do financial planning and investment advisement. But the biggest thing I do is trying to find someone that has an expertise in Social Security. And so the individual I have is in Park City. He comes up here a lot, and we visit a lot, and his name's TJ. And I'll have him, it's via Zoom, so we'll connect you with him, and then if we have questions after, feel free to ask me. And my heart is to have a relationship and have a connection where you have a free resource to ask me questions and make sure that you can address anything that comes up. So I do a software optimization report for you for free. What it is just trying to get an idea of when to draw Social Security. And I think that the key is to make sure you have options out there and you've evaluated all the different ages, 62, 66, and 70, and which one best fits your needs. So no further ado, I'll have TJ hop in, and if you have questions, we'll talk after.
Awesome. Thanks, Ron. Appreciate it. And my name is TJ Geis. I'm with Franklin Templeton. I'm here in Park City, Utah today. But Social Security was put in place by FDR in 1935. That's when it started, but really it took about 5 years, as you can imagine, to create a social support system large enough to accommodate the entire U.S. population, albeit a lot smaller then. It was still, a huge undertaking. So what I want to do on this slide is just show you how much Social Security has changed over that time period. So we go back to 1940 and we start with the payroll tax rate. In 1940, the payroll tax rate was 2%. Today, it's 12.4%. Then we look at, move this around just a little bit. Then we look at the earnings cap. In 1940, the earnings cap was $3,000. Today, it's 137,700. I remember when it was less than 120,000. That number is going up fairly quickly. Total beneficiaries. In 1940, you had 222,000 people receiving Social Security, while today you have 69,178,000. And I've given this presentation to you about 4 years ago. That number was under 60. So again, you see how quickly these numbers are going up. And then worker to beneficiary ratio. So in 1940, there were 159 people working for every one person receiving Social Security. Today, that number is less than 3 to 1. So you look at those last two categories, you can see where the strain on the Social Security system is starting to creep in. And then the average retiree benefit in 1940 was $22.60 a month. That sounds like a paltry amount, but you have to consider that the Great Depression had happened during the 30s, and you had unemployment rates over 20%, and you'd had this huge migration, somewhat like today, a huge migration of people into urban communities. And obviously there aren't the same social support systems in urban communities as there are in rural communities. And so you literally had people dying in the streets during the 30s. And so $22.60 a month may not seem like a lot, but at the time it was enough for a room in a boarding house, and it was enough to cover your meals for a month. And that was why this was originally put in place. Today, that's $1,503 a month. So obviously a much more meaningful amount of money, even considering inflation. So with that, before we dive into how we can use it, before we dive into whether or not that system's in real trouble, let's talk about what it is. And we ask people this every year, and we get some version of it's the check the government owes me, and that's absolutely right, but probably not our best way of thinking about it. What Social Security is it is a government-sponsored, inflation-adjusted, lifetime retirement income. And the sooner we think about it like this, the sooner we make a better decision with it. Sorry, my last click didn't go through. There you go, lifetime retirement income. This is how we should think about it in our minds. It is not just a check the government owes us. It is really a part of our retirement income picture. And the sooner we set it that way in terms of our financial framework, the sooner we're going to make better decisions around it, and the sooner we're going to live better outcomes in retirement. So with that said, before we can really trust in that process and believe in where this is going, it's important to consider the health of Social Security. And that's what we're seeing on this chart. Now, what is great about this chart is our marketing team was nice enough to color code it. But to be fair, the black and white version of this chart is something that Congress receives every year to understand the health of Social Security. So what you're looking at is this dark blue line coming across is the amount of benefits being paid out in Social Security. The dark green line is the amount being paid into the system. And so the first thing that you notice is that those two lines crossed, right? In 2010, we had more benefits paid out than brought into the system. Now, does anybody remember the lines for Social Security when people weren't receiving their income in 2010? Of course not, because we've been planning for this. Since the 80s, we have been saving more in the Social Security system than we've been putting in. And good news for all of us is that hasn't just gone into a cash account. That has actually been placed into the Social Security trust, into specific government bonds dedicated to Social Security. So when 2010 hit and we brought less in than we paid out, we started to use the income from those bonds. And the good news is that's covered us to now. The bad news is this year will be the first year that that income off of those bonds won't be able to pay for Social Security. However, we'll start to sell the bonds this year, and the trust is large. And so even with having to sell the bonds in the trust, we'll still be able to sustain that. Today, they're projecting until 2035. And that's when Social Security, the trust, runs out of money. Now, people hear the Social Security trust ran out of money, and they think that means that the Social Security is no more. It really just means that we can only pay out what we're bringing into the system, which based on current projections is about 80% of Social Security. So the point being, we have a long way to go until this becomes an immediate problem. That's already happened in the early 80s when Ronald Reagan took over. He was told he had 2 years until the Social Security Trust ran out of money. Now we've got a lot more than that. We've got 15 years to address it. And Congress in the 60s and 70s knew that this was coming and didn't do anything about it, much like we're seeing today. But it's still our perspective that this is a well-protected enough trust. It's important enough to the livelihoods of Americans. And if we think about who votes, it's skews very much towards the population that receives Social Security. So it's still our conviction that even past 2035, we can find a way to fix this because we've done it in the past. With that said, here's another quote from that report that goes out every year. For the 75-year projection period, the actuarial deficit is 3.21% of taxable payroll. This is 15 percentage points larger than in last year's report. I will translate that into English. What this means is the gap in Social Security is 3.21% of taxable payroll. So in other words, if the Social Security tax for employers went up 1.61% and for employees it went up 1.6 or vice versa, Social Security is solvent for the next 75 years. Generally not a huge fan of higher taxes, as I think most people aren't, but to have the equation be this simple, that if we make this change to taxes, Social Security is solvent for the next 75 years, shows you that this is a manageable problem. However, as it says in the second line, this is 15 percentage point larger than in last year's report. So it's something, the longer we go, the wider that gap gets and the harder it is to fix. So it is something that we hope people make progress on in the not too distant future. So with that, if we know Social Security is going to be there, choosing the age to file is more important than ever. And I'm going to go quickly through this. Basically, these are two quotes from leaders in the retirement space explaining why it's so important to think about when you're going to take Social Security. The Limmer Secure Retirement Institute says, for a 65-year-old couple, there's a 50% chance one of you will live to age 93 and 1 in 4 chance that one of them will see age 97. So if we take Social Security early and it's a lower payout, that's for over 30 years or more. And then Richard Thaler says, wait as long as possible because the less you have to worry about living too long and the greater your retirement budget. So with that, what do we mean when we say waiting? Well, let me introduce you to Sarah. Sarah was born, as you can see, June 5th, 1958, which means her full retirement age is 66 and 8 months. Her benefit at that point would be $2,432. Her parents are alive and well into their 90s, so she thinks her life expectancy is 95. So what are the 3 universal ages for Social Security? Well, 2 are universal, 1 depends on when we were born. The first universal that's unique, that is not unique for any of us, everyone can take their Social Security on their own benefit at the earliest age of 62. So 62 is the first age that anyone can take Social Security on their own benefit. At that point, it's going to be reduced by the maximum amount that can be reduced. So every month you take Social Security prior to full retirement age, it is reduced. 62 is the maximum reduction, which means that if she turned it on at 62, she would receive $1,411 for the rest of her life. Now, that would be adjusted by cost of living adjustments would be the only change to that. But she locks herself into $1,411. By age 80, assuming cost of living adjustments of 3% a year, she'll have received $402,400 in Social Security benefits. By age 90, she's now at $700 and almost $38,000. What if she waits till full retirement age? Well, again, for every month that she waits, her benefit goes up. Social Security told her she would receive $2,432. She kept working. That's what she receives. So by age 80, she's at just under $475,000. By age 90, she's just under $1 million. So full retirement age is the one that changes. It depends on when you were born. This is part of the changes made by Reagan. So if you're curious about what your full retirement age is, you can simply go to ssa.gov, enter your information, and they'll tell you. Or I'm going to send Ron a few pieces after our conversation today that he can pass along that will show you what your full retirement age is. And that would definitely be part of that analysis that he can do on your behalf. Then the last one is 70. Now this is really important. That is the latest age that you can see your benefit go up. So in other words, From full retirement age to 70, you earn what are called delayed retirement credits. So 8% a year for every year that you continue to wait. So in other words, for every month that you wait, it's 0.2% that your benefit goes up until 70. Once you hit age 70, Social Security does not get any better. Unfortunately, one of my associates gave this presentation and had a gentleman who is 75 years old who shared with her during the presentation that he'd never taken Social Security, and she had to find a tactful way to explain it to him that he had missed out on 5 years of Social Security. Don't do that. If you elect to wait, which, as Richard Thaler said, gives you the highest amount available, your best bet is to take it at 70. So that means that for her, she's now receiving $3,524. By age 80, she's at $492,056, and by age 90, she's over 1.1 million. So this is why people talk about waiting, because if she took it at 62, by 80, she's earned 402,000. If she waited till 70, so she missed out on 8 years of the 18 that she did in that first example, because she's receiving $3,524 and it's so much more, by age 80, she's now at $492,000. She's almost $90,000 farther ahead, having taken it at 70. And from then on out, for the rest of her life, those numbers become that much higher, as we can see at the 90, 1.1 million versus just under 740,000. So this is why we talk about waiting. It's not because anyone wants to keep people from taking their Social Security. It's simply because the economics tell us that if you live beyond your late 70s, you will benefit having waited. So with that, what does taking Social Security at 62 reduce your benefit by? It's 25 to 30%. Full retirement age starts to increase from 66 to 67 for those folks born in 1955. So what if you took Social Security and you wish you hadn't? If you're under full retirement age and you file for Social Security and you want to stop receiving it, here's what you have to do. Do so within 12 months. File a request for withdrawal of application. So you have to go into Social Security to do that. You have to repay any benefits received by you and anyone getting a benefit on your record, and you have to repay all Medicare premiums deducted from your checks. Simple as that. If you're able to do that, though, Social Security treats it as if you've never filed. So I know this sounds far-fetched, but the environment we're in is actually a good example of when this would be helpful. You have people who were laid off or furloughed in March because of the pandemic, and at the time they needed everything they could to make ends meet, so they file for Social Security. Turns out they get stimulus benefits, and then they end up finding a job, or their company fires things back up and they get to go back to work, and now they're wishing they hadn't filed for Social Security. Well, they can use the extra income, pay back these benefits, and then choose to file at a different date. If you're over full retirement age, or it's beyond 12 months, but you want to increase your benefit, you can suspend your benefit. And all you have to do that is contact Social Security and request it. There's no repayment required. The only thing you want to remember is anyone receiving a benefit tied to your record will have their check suspended as well. So I'll give you an example. I'm going to run through this fairly quickly. So Archie and Edith, Archie worked at the No Holes Barred golf course for 20 years until they decided to turn it into a shopping mall. He's 63 and had to start Social Security at 62. Edith, his wife, was a math teacher at a community college until they had kids. And 6 months after Archie got laid off, she said, you know what, I'd like to get out of the house a little bit more. You're driving me a little crazy. And I'd like to bring some more income into the house. I really enjoyed teaching. So she went back and started teaching high school calculus. So the good news is they meet their day-to-day living expenses with that income from her teaching. She loves it. She plans to continue until mandatory retirement at 70. Problem is Archie wishes he hadn't taken Social Security early. He's worried that when she has to retire at 70, their benefit won't be enough. And so they go to Ron and say, Ron, what do we do? And here's what we know. His benefit would have been $1,800 a month at full retirement age, but he took it at 62. So he's receiving $1,358 a month. So if he does nothing changes between now and 90, he's going to receive $701,093 based on cost of living adjustments in that 28-year period. But what if he suspends? So he takes the $1,358 a month. We can't change that. Between now and full retirement age, it's been 12 months. He can't withdraw. So he receives $66,794. Hopefully they find a nice investment portfolio to put that piece into. And then at 66, he's going to suspend. So for 4 years, he won't receive his benefit. When Ron shares this plan with him, no doubt he would look at Ron a little funny when he's saying, I want more benefit and you're giving me less. But that's when Ron would explain, this is the power of delayed retirement credits. From 66 to 70, your benefit increases 8% a year plus cost of living adjustments. So now at age 70, when we turn it back on, you're at $2,270 a month, which means by age 90, you're at $802,818. That's $100,000 extra for Archie and Edith to live their life in retirement. This is the power of suspending. The other example I want to share with you is our friends Liz and Richard. Liz is eligible for Social Security based on working small parts in a local theater company, but most of her focus has been on her children. Richard, I'll tell you a little bit about it in a second, but the important thing you need to know is they were high school sweethearts, going steady at 16, married at 20, and unfortunately divorced at 32. Background on Richard: before deploying to Vietnam, he was discharged from the Navy after he mysteriously fell off the USS America. They got divorced after 12 years of marriage, and there were 2 kids and a mortgage. And Richard said, I've had success in this PR gig in a small town we live in. Imagine what I could do in Hollywood, where he went on to have a very successful career running a studio. Unfortunately, despite alimony, Liz has had a real hard time making ends meet while raising her kids. And she's been unlucky in love. Her 4 subsequent marriages lasted from 2 to 8 years. So what can she do in terms of a benefit? Well, we know she's 62, as is Richard on January 4th of 16. Full retirement age for both of them is 66. Her benefit's $800 based on the theater company. His benefit based on his successful career in Hollywood is $2660 a month. So what does she need for a divorced spouse benefit? 10 years of marriage, a spousal benefit and ex-spousal benefit are treated in terms of the income you receive exactly the same. 50% of ex-spouse's benefit. If you're looking at a spousal benefit, you're going to be eligible for 50% of your spouse's benefit if you choose to go that route instead of going on your own benefit. The earliest age to file for reduced benefit on a spousal benefit is 62. A couple key things here is your ex-spouse must have started Social Security, or you have to be divorced for at least 2 years in order to be eligible. If you have more than one ex-spouse, the benefit is based on the ex with the highest benefit. And in most cases, you lose the benefit if you remarry. Now let's talk about Liz's benefit. Is she eligible for her own? Absolutely. On how many ex-husbands is she eligible? Just one, Richard. Again, the other 4 were 2 to 8 years, so they don't factor into this. Can Liz choose which benefit she wants? Unfortunately, she cannot. This was a change in 2015. If you go into Social Security and you're eligible for 1, 2, 3, however many benefits, they're just going to automatically lock you into the highest available. Can she receive her own reduced benefit and switch to a full 50% divorce spouse benefit at full retirement age? She cannot. If she needs a larger benefit, well, what could she do? She could delay claiming until full retirement age, so wait. Or she could get remarried. She has to make sure husband number 6's benefit is larger than Richard's, though. And I'm not sure if you can put that on your online dating profile. So a couple key concepts here is an update on our friend Richard on a sailing trip to Catalina Island with his second wife. Once again, Richard falls overboard. This time, unfortunately, he drowns. Hollywood elite are devastated. But for our example and for our friend Liz, new options are available. Quick rundown on a widow's benefit. You have to be 60 years old. So it's the only benefit you can collect prior to 62. It will be reduced an additional 2 years. Minimum length of marriage is 9 months if married to the decedent at the time of the death, 10 years if divorced. Maximum benefit is 100% of deceased spouse's benefit at time of death. Impact on benefit received by other spouses. In other words, because Richard was remarried, does that affect Liz? It does not. So both of them are eligible for this. What options does Liz have? And I'm not going to go through each of these examples separately, but the key you have to understand is that in a widow's benefit, you can file for your own benefit and switch the widow's benefit. You can start with a widow's benefit, switch to your own. So the nice thing about a widow's benefit is it's the only one that you can switch along the way. For her, what she would want to do is file for this, her own benefit at $600 a month, and then switch it full retirement age to Richard's higher benefit. So she gets a little bit to make ends meet right now. And then eventually she switches to that higher benefit. So for the rest of her life, she's receiving that higher amount. Couple key concepts here is if you outlive multiple spouses, your benefit is based on the highest amount available. And the last two are important. any Social Security benefit received prior to full retirement age, if you file for Social Security before full retirement age and continue to work, it can be reduced by what's called the earnings test. And that'll be covered in the information I'll send over to Ron. But if you have questions on that, we're happy to share that. And only your own benefit earns delayed retirement credits. So in other words, if you're going to file on someone else's benefit, file at full retirement age. On your own, you can wait till 70. On anyone else's, file at full retirement age, because anyone else's benefit does not get better past full retirement age. So with that, that was a highly abbreviated version of a 1-hour presentation. I did it in just 1 minute more than the 20 I was allotted, so forgive me. But I'm happy to answer any questions, happy to expand on anything that you guys would like more information on.